Alright, hello. My name is Jennifer, and I'll be doing a head-to-toe assessment on Dominique, my patient, today. So, hello, how are you?
Good.
I'll be doing a head-to-toe, and this was for my final didactic examination. Alright, so first we'll start with the skin, and then I'm inspecting the skin, upper extremities and lower. I'll start by feeling and nice and warm. Checking the capillary refills on the hands. They're nice and pink. The nail bed is at 90 degrees. There's no clubbing noted. Capillary refill is less than 3 seconds. That's also assessing the cardiovascular. So I'm assessing the lower extremities, and I'm also taking note of the hair distributed on the patient, and it's evenly distributed. Skin is nice and warm. It's dry, nice and elastic. For upper and lower, no edema noted. The tone is normal for ethnicity. Again, feet are nice and warm. Alright. And the hair is also evenly distributed for the male pattern and ethnicity. Let's see. I'm just taking a look. Alright, and you also notice on the skin, a lot of hair evenly distributed. It's normal for representing the male pattern. There are some macules noted on the face. Right. Okay. So next we're moving on to the head. And the head is nice and normal cephalic. Just taking a look. The skin tone is normal for ethnicity. There is no redness or any type of inflammation anywhere. I'm just going to take a look and palpate the head for any lumps, any tenderness, any pain.
No.
Okay. There is evidence of male pattern baldness noted. There is a little bit some dry areas noted on the scalp, but the scalp is it follows the same pattern of the ethnicity for the patient. Okay. Next, I'm taking a look at the ears. Are nice and lined up with the eyes. It's nice and symmetric. I'm just feeling any pain or tenderness.
No.
There's no lesions, there's no pain, there's no tenderness, there's no lumps, there's no inflammation noted for the ears. I'm just palpating the masseter process. Any pain or tenderness?
No.
Okay. All right. I'm also going to just take a look. I'm inspecting the eyes, the nose, and the mouth as well. And then the eyebrows, they're nice and thick. The hair also is nice and it's soft and thick for the texture, and it's the same pattern throughout the face and the beard and the mustache. The eyelashes are long. They're not that nice and symmetric. Can you blink your eyes for me? Okay. They close, and they close nice and symmetrically and open up as well. They close your eyes. Keep them closed against my resistance. Okay. Open. Now open out, look up. Right now I'm just looking at the conjunctiva, nice and pink, moist. Sorry, give you a second. I'm looking up. Look down for me when I look up. All right. And nice and pink and moist as well up top. Okay, for the ears, I'm just going to take a look. So usually for the adults, we usually, you can turn your head for me. Raise the ear up and back so we can get a good view. Sorry. Secure it a little tighter. So I'm looking for the tympanic membrane looks nice and pearly gray. There's no redness. The cone of light, you can see it's located at the 5 o'clock position. The other structures, the malleus and the incus, you can note them present as well. There's no fluid, there's no redness. Okay, same. The tympanic membrane is absent of any redness. Was there any pain in your ears? There's no fluid. No. Noted. And the cone of light was noted at the 7 o'clock. There was a little bit of cerumen noted in the ears, but nothing obstructive. It was located on the outer external canal. A little bit of hair distribution noted in the right ear. I'm also going to do a thorough eye assessment. So right now, we looked at the conjunctivae, and it was nice and pink. The sclerum is nice and glossy. You note the cornea. Pupils are nice and round. And the iris is brown. So open your eyes for me. So look straight at the wall. I'm just going to look at the cornea, testing the reflex. Okay, good constriction there. Look straight for me. So just checking the pupils, and they restrict, and the perla was noted that pupils were equal, round, and reacted to light. And I just want to test for accommodation. Now open your eyes. So next I'm going to test for cranial nerves number 3, 4, and 6, oculomotor, trochlear, and abducens. So I want you to follow this pencil for me. All right. This is the 6 cardinal gaze that tests the extraocular movements. There should be some convergence with the eyes going in close. All right, so cranial nerves number 3, 4, and 6 are present. They're nice, they're intact. Next, I want to just look at the structures of the eyes. So I'm going to dim this light. I'm looking for the red reflex, and I'm also looking for the optic disc and locating the macula. All right, you gotta open your eyes for me. Okay. And Basically, I'll be holding, when I'm testing the right eye, I'll be looking at it with my right eye. So, this is your left, this is your right. Okay, so look straight at the wall. So I'm gonna open your eye for me, please. So I see the ray reflex. So I'm just gonna come in at a good angle so I can see the rest of the structures. And knowing the optic disc is nice and creamy brown color. It's round. The macula was noted, it was a little darker. You can see the structures of the vessels noted. There was no overlapping with the blood vessels, and the optic cup was less than the diameter size of the optic cup. And I would do that with both eyes. All right, next I want to test the nose. And I'm going to ask you to hold one of your nose and just breathe in. Okay, take the other one and do the same. So there's no obstruction. The nose is nice and symmetric with the rest of the face. You know, lesions noted at this time. All right, look up for me. Come take a look all the way up. Let me take a look in the nose. And there, of course, there's hair present in the nostrils. The mucosa is nice and pink and moist. The septum is not deviated. And the turbinates are nice and moist and pink. There's no drainage. There's no redness indicating inflammation or any extra discharge at this time. And the next test I want to test is the cranial nerve number 1, is the olfactory, the smell. So I'm going to ask you to close your eyes and occlude one of your nostrils for me. And take a smell, a breath. And can you identify that for me?
Like mint.
Okay. All right. Occlude the other nostril, the other. Okay.
Same thing, man.
Okay. So cranial nerve number 1 is intact. All right. The next thing we want to move to is the mouth. And looking at the mouth, it's nice and moist and pink. There's no ulcers noted or blisters noted at this time. I'm going to ask you to do some facial exercises. I'm going to get back to the mouth testing for cranial nerve number 7. So I want you to smile for me. I want you to frown. I want you to puff out your cheeks. Okay, I want you to, okay, you can unpuff your cheeks. All right, that was testing for cranial nerve number 7, the facial. For the trigeminal, I want to try to open, I'm going to press down. I want you to try to keep your mouth closed. And I want you to wiggle your jaw from side to side. Okay, stick your jaw out and in. No, out and in. Okay, that's testing trigeminal cranial nerve number 5. So also for the trigeminal, I want to test for the sensory function. And so I want you to close your eyes, and I want you to tell me when you feel something soft. Open your eyes. This will be soft, and this will be sharp. Okay?
Okay.
All right, and you'll say now, and then you'll say sharp or soft. Close your eyes.
Now soft. Now soft. Now sharp. Now sharp.
That's testing cranial nerve number 5, the sensory trigeminal. All right, open your mouth for me and say ah.
Ah.
A big ah. So I'm looking in the mouth. Looking around, and the mucosa is nice and pink. The soft palate and hard palate are intact. Say ah, stick out your tongue. Ah, ah, look up. Thank you. The uvula is nice and midline. The tonsils are +2. Okay, we can stop saying ah. And there are caps noted. The gums are nice and pink. Say, open your mouth and stick up your tongue for me. Stick up your tongue. So I'm looking for the frenula and the Stensen's duct. It's nice. The blood vessels are nice and moist and pink and red. All right, the tongue has nice papillae on it as well. Could you do me a favor and also stick out your tongue and move it from side to side? Stick out your tongue and move it from side to side. Okay, and this is testing for cranial, okay, you can stop. Cranial nerve number 12, hypoglossal. All right, so the next that I want to do is look at the neck, and I'm basically assessing the neck. And the neck is very interesting because you have the thyroid and you have your carotid arteries. I'm just looking at the pulsation on the carotid. You note some slight pulsation, that's normal, as long as it's not bounding. I'm just going to palpate. All right, they're normal +2. I'm also going to palpate the thyroid. The trachea, I'm sorry, is nice and midline with the neck. For the thyroid, I'm going to ask Dominique, I'm going to ask you to swallow for me. When I say swallow, I'll be feeling for the thyroid float along my fingertips. I'm actually going to come around. You can say just like that. So I'm going to displace the thyroid just a little bit. So I want you to swallow. All right. So the thyroid, it doesn't feel enlarged. Was there any pain or tenderness when I was feeling?
No.
No pain or tenderness at this time. All right. I'm also going to take a listen to the carotid arteries. Okay. There were no bruits heard, which is great, because bruits indicate cardiovascular problem. Okay. The next thing I want to have you do is some neck exercises. I'm actually going to be looking for the range of motion for the neck. So I want you to first extend your neck backwards and forward, straight and then side, and then right and left. I want you to do the same thing against my resistance. Extend your head back. Okay, forward. Okay, side. Okay, okay. So that's testing the range of motion. And I'm also going to test for, I want you to shrug your shoulders. Okay. Try to shrug against me. Okay, that's testing for cranial nerve number 11, the spinous accessory cranial nerve, and it's intact. I also want to palpate, lay your head down for me, the spinous process. It's nice and intact. Any pain or tenderness?
No.
Okay. All right, so next, moving. Let me also take a listen. Look out for me. I'm listening to the trachea. All right. Usually it's like a harsh pitch sound, and it was, so that's normal. All right, so that will conclude with the face, the structures of the face, head, and neck. So next, I want you to take off your shirt. You're gonna listen. First, I'm gonna take a look and observe. He doesn't look like he's in any respiratory distress. I am now assessing the respiratory system. And I'll be also assessing the cardiovascular system and in the abdominal area. So the skin is the same color and tone, normal for his ethnicity. There's no respiratory distress, no accessory muscles usage. You know, I note that the breathing, he does use some abdominal, which is normal for the males. They usually tend to breathe more abdominally. The AP, anterior posterior, is 2:1, which is normal. And before I put this on, I'm just going to go ahead and palpate, and I'm be testing for tactile premises for the vibrations, which would usually be normal and diminishing toward the lower bases. Usually if it's a lot of fluid in the lungs, you won't feel these vibrations, okay? So I'm going to place my hand on your chest, and when I do, I want you to say 99.
99, 99, 99, 99, 99, 99.
Okay, great. So tactile firmness was noted. Also, all right, I'm going to have you breathe. I'll be measuring how smooth it is when you take a deep breath in and out. All right?
Mm-hmm.
Okay. All right, take a breathe for me. All right, so it was nice and smooth. The lungs expanded with no type of rigidness or hard effort noted. Next, I'm going to auscultate. I want you, every time I place it, some slow deep breaths for me. Hold your arms up for me. Breath sounds were clear No adventitious sounds heard. They were equal bilaterally. Okay, so I want you to turn this way for me. You can stay sitting up. Alright, so now I'm just going to take a look at the posterior thorax. Alright, so just assessing the skin. It's nice and smooth and intact. You'll notice some macules present on the left and right side upper thorax. The spinous process is intact. The normal curvatures is present with the spine. So I'm going to just feel, I'm gonna palpate like we did up front, okay? I want you to say 99 every time you feel my hand, okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Great. Tactile pharyngeus was present. Alright, so next I'm going to percuss, and it should be a resonance, like a hollow resonant sound heard. Resonance was heard. You try to stay away from the scapula because it can be some dullness heard, but resonance was heard. Next, we're gonna do the same and check for the breathing. All right, take a smooth, deep breath in and out. All right, good breath sounds and good respiratory pattern, nice and smooth and even bilaterally. So next we'll check for diaphragmatic excursion, and basically that is it's measuring how much movement or how much the diaphragm moves when the patient breathes in and out. So first I'll ask you to go ahead and breathe normally, and you're gonna breathe out and hold your breath until I say let go, okay? All right, so breathe normally and breathe out and hold. Breathe, okay. You can breathe normal. So take a deep breath, breathe in, and then you're gonna breathe in and then hold. Ready? Breathe in and hold. Hold. And I would do the same both sides. You can let go. These three. Which is in the normal range. All right, so the next I will do is auscultate before the breath sounds. Slow deep breaths. Breath sounds are clear, equal bilaterally. There's no adventition sounds noted at this time. All right, you can turn around for me. All right, so I just want to do one more respiratory assessment. And just sit and relax for me, please. Taking note of the respiratory pattern. Respiratory rate is 14. It's nice and smooth, and even and equal, and no evidence of distress. All right, I'm gonna have you lay down for me. So we're gonna move along to the cardiovascular. I just wanna just take an assessment and noticing that as I take note, and I also feel there's no evidence of any lifts or heaves felt or saw at this time. I want to take a listen to the heart sounds, and then I'm also going to take a listen to the pulses. So checking the aortic. There's no bruits or no murmurs. Volumnic. Point of maximal input. I'm also going to palpate for that. You can feel some pulsations felt normal. All right. So I'm also going to assess the temporal pulse, brachial, radial, deferring the femoral, popliteal, tibialis, pedal. All pulses are present, +2. There's no bounding. He has great pulses throughout. All right, Dominique, we're almost there. So now relax your arms. Moving on to the abdominal assessment. Just notice, you'll notice some pulsations, that's normal. Some vascular some vascular pattern. And he also has hair noted. You can see the pulsations. That's pretty normal. The umbilicus is symmetric and it's inverted and it's aligned. It's in line like it's supposed to be with the rest of the abdominal area, midline. So next, I'll be taking a listen. I'll be taking a listen to the bowel sounds. Bowel sounds are present in all 4 quadrants. Now I'm taking a listen with my bell to the aorta, renal, iliac, femoral, iliac, and femoral. And there were no brutes heard over the artery, heard through the arteries. Next, I want to percuss you'll note some tympany, usually heard through the abdomen. You'll notice some dullness over the solid organs. I'm just going to percuss now. Any pain or tenderness? Abdomen is nice and soft. It's nice and soft and flat. No tenderness noted per patient. Bowel sounds present. I'm going to feel for the liver. Can you take a deep breath for me? And it feels nice, soft. I'm feeling for this spleen, which is a little bit more difficult. Take a deep breath for me. Which is usually not felt, and it's not felt now, which is normal. And the bladder is absent of any distension. Okay. I want you to sit up for me. And we're going to palpate those kidneys. I want you to tell me if there's any pain or tenderness noted. You can turn to the side. Alright, so I'm going to palpate the kidneys. Any tenderness? Any tenderness?
No.
You can turn around for me. Next, just turn around, regular. No, turn around regular. Oops. Next will be, you can actually stand up. We're going to do a little bit of exercising. And we'll be wrapping this up soon. Okay. Hour. Okay. So I want you to walk from right here to right here and turn around. I'm assessing gait. Gait is nice and steady. It's equal. All right, you can stop right there and turn to me. There's no unsteadiness. I'm going to test for the Rombert's sign. So close your eyes for me. And we usually are assessing for any type of swaying. And if it's negative Rombert's test, you can open your eyes. And that test is the can't get it out. Cerebellar function. Sorry, tongue-tied. Sorry. And so that was negative. Next, we're going to do some. I want you to walk heel to toe. This is also assessing the cerebellar function and steadiness. And then turn around and then come back to me. All right, so patient was nice and steady. Okay, the next thing I want to test is the range of motion. So you're going to start with your shoulders. So abduct, adduct, abduct, adduct. So we want external rotation, internal rotation. Right. So I want you to flex, straight up, hyperextension, straight up, more lateral. Okay. Next, I want you to hyperextend the hip. Come back. Okay. Next, I want you to have a seat so we can do the rest of the hip. And lay back for me. All right. So I want you to cross your legs for me, one at a time, like a lady. Cross, yeah? Uncross, cross, uncross. And I was testing, that actually tested for the glutes and the hamstrings muscles. I want you to take your knee and kind of bend. And then internal. You'll do that on your own. Okay, come straight. All right. I want you to raise your leg. All right. Raise your other leg. I want you to do it against my resistance. Raise. Okay. Raise. Raise. Okay. I want you to extend your right leg outwards and then in. Do it against my resistance. Okay. In. Okay. Same with the left. Okay. In. Okay. Try again. Okay. Okay. I want you to dorsiflex your foot, pointing up. Both. Down. Plantar flex. Do it up against my resistance. Okay. Down against. Great. Testing the strength and range of motion, they're intact. For the hip and for the knees, I want you to bend your knee and then straight. So you're flexing and extending. Great. Bend. Okay. Bend. Okay. want you to invert your ankle. So in, eversion, and then, inversion is in, and then eversion is out. Do it with both. This one, and then out. Do it against my resistance, and then out. Okay, same with this. No, in. Okay, out. Okay, great. All right, you can stand up for me. Okay, I want to test the wrist. So we're going to, I'm sorry, well, not the wrist, the elbows while you're standing. You're going to bend, so you'll flex and extend. Flex, extend. All right, flex. Okay, extend. Okay, great. Okay, next, the wrist. So your flex, extend, flex, okay, flex. Great. So you'll extend your fingers as and then bring them in. So try to bring them out. Okay. Try to bring them in. Okay. All right. Hold your wrist. All right. The next I want to test for is the sensation. So I want you to say now, and what do you feel? Soft or sharp, right?
Soft. Now soft. Now sharp. Now sharp. Leg now sharp. Left leg now sharp. Left foot soft. Right foot soft.
All right, and I was testing a sensory. I also want to test the stereognosis, and basically that is testing for an object a patient usually should be able to identify. So I'm going to ask you to close your eyes. I'll put something in your hands and I want you to be able to tell me what it is.
Key.
Great. Open your eyes. It's a key. All right, the next I'll be testing for is graphesthesia. And then I will draw something on his hand and he should be able to tell me what it is. All right, close your eyes.
Three.
Great. The number 3. So those are both intact. So next I will test for the position sense. So this is neutral, this is down, and this is up. And we will usually do this for the upper and lower extremities, okay? All right, so close your eyes and tell me what position.
Down. Straight. Down. Up. Down. Up. Down.
Great. Next, I also want to test the joints for just the vibration sense. So I'm going to put this on the joint. Until now.
Yeah.
Okay. And when it stops, let me know.
Stop.
Great. Okay, so the next I want to test for is the reflexes. Well, before you stand, could you bend forward for me? And this is, I'm looking for it's a nice curvature. There's no deviation with the spine, no scoliosis noted at this time. All right, you can stand up. I was looking at the spinous process. All right, so the first reflex would be triceps. All right, great. I would do this usually bilaterally. That was the triceps. Next is relax your arm, okay? Next will be the brachioradialis. I'm sorry, I'm gonna do biceps first. Great. Now brachioradialis. Great. Now I want you to just kind of look to the left or the right and just kind of pull your hands together. That was the patellar. And next, I'll be testing for the Achilles. So everything was about a plus 2. They were nice and normal. You can relax. Maybe about a +1 for the reflex down there. And so this concludes the physical head to toe examination. We're going to scan the room one last time. Thank you.